Alright, today I'm going to do an airway clearance with an acapella. So the first thing I'm going to do is check the patient's chart, and I noticed that they had just gotten done with a nebulizer treatment, and these are good devices after a treatment to help get those secretions out of their lungs. So when I'm ready, I got my everything I need, and so I knocked on the door, checked the patient's ID band, and then I'm going to do the vital signs, pre-vital signs, and then I'm going to wash my hands, dry them, and I'm going to demonstrate on how to do the acapella. So this acapella is going to create a fluttering in the lungs, and this will help clear out the lungs. And I'm going to instruct the patient that this is just going to help him cough up any secretions. And also, when I check the patient's charts, I need to make sure that the doctor doesn't need any of the secretions that they may cough up. And if they do, then I need to have a sample cup for the lab to have. So first off, depending on the patient, and especially if they're an elderly patient, I'm going to start them off at the lowest resistance. So you want to have it towards the negative side. And so I have it at the negative side. And then I would instruct the patient when they're doing this, I'd have them take a nice deep breath in. And then when they exhale, have a nice strong exhale, but not forcefully, but long enough to get that fluttering valve to go. And then if they feel that they hit a restriction when they're trying to blow it, they continue on, and as that's just the fluttering valve that's going to start working, and it's going to make their lungs start opening up their lungs more. And then if they, always instruct the patient, if they have a nebulizer treatment, not to place it onto here, as this can cause clumping with the particles from the medication, and it can cause this to malfunction when they use it. So I'd instruct the patient to hold it like a microphone, put the mouthpiece up to them, make sure their tongue is underneath the mouthpiece, take a nice deep breath in, and exhale forcefully, and then it should make like a fluttering sound, and it'll make it cough up. I'd have them do this for a few times for the 10 to 20 minutes, and take a break just depending on how they're doing on it. If they feel like they're gonna faint, and then I would instruct them just to do it a couple times, and I'd walk them through it to make sure they are doing okay. Once I'm done with this, it comes with a bag, and you can put the patient's name and room number on this, and you can place it into this bag. And you're not to wash this. If they ask if they can, they're not allowed to wash that. The only thing that they can wash is a mouthpiece. And so I can hang this up to their patient's bed, or I can, if they're ready to go home, I can set it off to the side so that way they can have it to take home with them. And when I am all finished, I need to reassess the patient, check their vital signs, and then I need to go chart it on the patient's chart and let the nurses know that I did a treatment with them.